Hello and welcome everyone. I'm Siobhan Carroll from Intraprise Health and I'm the host for today's HITRUST webinar. Thanks for joining us. Today's webinar is on Catapult Health's journey to HITRUST certification, focusing on how they successfully prepared for and received their certification. The webinar itself will take about 45 minutes, leaving 15 minutes at the end for Q&A. Before we get started, I wanted to go over a couple of quick webinar tips. Throughout the webinar, we'll keep all lines muted to prevent background sounds. If you need to get in touch with me, please use the chat feature, which is accessible by clicking on the chat button at the bottom middle of your screen. If you have questions you'd like the presenters to address, please chat them to me whenever you think of them, and our presenters will answer them at the end. After today's session, you'll receive an email from us. If you're interested in a copy of the slides, please let me know. For those of you who don't know, Intraprise Health is 100% healthcare focused. We're one of the longest tenured certified HITRUST assessors with extensive experience in the NIST cybersecurity framework. Intraprise Health has been appointed to 2 seats on the HITRUST Assessor Council and holds 1 seat on HITRUST Quality Assurance Subcommittee. We also provide a range of cybersecurity services as well as protect a third-party risk management platform. So I'd like to introduce today's presenters. Unfortunately, one of our presenters, Melissa Hawkins, had a family emergency today, so Ryan and Joe will have to soldier on. Our special guest today is Joseph Bell from Catapult Health. Joe is the Vice President of Technology for Catapult Health. As such, he manages the technology that powers the nationwide delivery of preventative care health evaluations, remote telemedicine stack, and the security of personal health data. Over this last year, Joe has led Catapult Health's efforts in earning the coveted HITRUST certification and continues to manage their data security program. Ryan Patrick is Intraprise Health's Senior Vice President of Security Services. Ryan has over 17 years of healthcare IT and security experience across multiple security frameworks. As a cybersecurity expert, Ryan brings an innovative perspective to protecting information and organizational resources, having worked as a security analyst at both MetLife and Memorial Sloan Kettering. Ryan has been a battalion commander at the United States Army Reserve since April 2017. His previous military assignments include serving as Global Enterprise Operations Center Team Chief for U.S. Special Operations, Chief Information Officer of the 42nd Infantry Division within the New York Army National Guard, and as Deputy Chief Information Officer and Chief Information Officer of FEMA Region 2 Homeland Response Force. Thank you both for joining us today. And Ryan, why don't you take it from here?
Thanks, Siobhan. So as any good IT or security professional that lives in a very dynamic world, as Siobhan mentioned, our colleague and friend Melissa is tending to some family emergencies, so we wish her our best. Luckily, it's nothing life-threatening, but it's definitely something that needs to be addressed. But we will soldier on, as Siobhan mentioned. We will adapt and overcome. So here we are. Joe, I want to take a second just to personally thank you for joining us. I think your insights in your personal journey and the journey of Catapult really are going to open up a different paradigm or perspective when it comes to these types of information sessions. Normally what we see are people like myself, or even when we're able to get folks from the HITRUST Alliance on board, you're getting it from a very specific perspective. So having someone who's gone through the journey as an assessed entity is critical. So thanks for joining us. So let's talk about the HITRUST CSF really quickly. So what is it? What does it do? What does it do for your organization? And really, what does it do for your business partners? As you can see on the slide, it's becoming or is the gold standard at this point in the healthcare industry. 81% of US hospitals and health systems and 80% of US health plans have adopted the CSF in some way, shape, or form. And actually, the HITRUST CSF is now starting to expand beyond healthcare, which is very interesting because it only solidifies the importance and the relevance of the framework itself and the methodology in the greater security and cybersecurity realms. It's really scalable. So you're going to hear Joe and I speak about how it's scalable through a number of different ways. But it really can apply to organizations of all sizes. And I'm really proud to be able to report that from an enterprise perspective, we have gotten certified organizations as small as 2 people. And we've also gotten multi-billion-dollar organizations certified. So if that doesn't tell you that it's scalable, I'm not sure what else will. the competitive advantage. Anytime that you can hand a business partner or potential clients a report that has been quality checked through a number of different levels, it's going to separate you from kind of the pack when it comes to the reliance on your security and privacy program. So some of the benefits that you'll see here is it demonstrates organizational commitment to managing risk and improving security postures. And one of the great things that I feel that the CSF itself in the certification process itself is it inherently forces you to adopt the CSF. Certification normally is kind of the goal, but the hidden prize in getting certified and maintaining that certification is you're forced to adopt a framework, the CSF itself, and you have to apply that framework every single day during your business processes to ensure that you're going to maintain that certification. So anybody that is HITRUST certified and can demonstrate their certification over a number of years, you can be pretty certain that they're taking security and privacy pretty seriously. So what's increasing the demand for assurance? Increased risk by third parties, that's nothing new. Some of them, the biggest breaches in the past, I'd say 8 to 10 years have been as a result of insecure third parties or business partners. Increased cyber threat landscape. So we're focused on the healthcare industry. It's not unknown at this point that healthcare is one of the most targeted industries in this country, if not the world. There's lots of reasons. I could give an entire webinar just on that alone. Confusion. The HIPAA security rule and privacy rule kind of left us confused with not knowing what's reasonable, appropriate, or adequate. The CSF addresses that pretty well, actually. It's pretty prescriptive in what it's looking for organizations to do in order to meet the compliance and ultimately get certified. And then ultimately, if there's an increased threat landscape and there's been breaches, growing compliance, risk and liability, whether it's legal costs, recovery, what have you, organizations and boards and executive teams are really trying to find a way to get that warm and fuzzy that they can reduce those types of costs. So a quick once over the world on the CSF itself. It's made up of 19 domains, and there's roughly 1,900 plus requirements that are spread out across those 19 domains. That doesn't mean that if you go for HITRUST certification, you're going to have to demonstrate your compliance to 1,900 requirements. There's a whole scoping exercise, which we'll get into in a future slide, that will actually evaluate your risk posture through the eyes of HITRUST and the HITRUST methodology, which will then levy the number of requirements that you'll have to demonstrate your compliance to. We typically see anywhere from 300 to 400 requirements as an average across kind of our client spectrum. And the CSF itself is based off of ISO 20001, but be assured that it touches or it can be mapped to just about every known framework on the planet at this point. Each iteration right now, they're on version 9.4. Each iteration, they are adding more and more capability when it comes to applying to other frameworks and covering kind of the known and in some ways unknown vulnerabilities within the security and privacy world. So I'm going to kick it over to Jill real quick, give us a quick background on Catapult, and then we'll go from there.
Sure. Well, once again, thank you, Ryan and Siobhan and Intraprise Health for inviting me to share our HITRUST journey with you today. And I share the sentiment we've expressed with regards to Melissa being unable to join us today. So again, my name is Joe Bell. I'm the Vice President of Technology at Catapult Health. Catapult Health is a national preventive healthcare practice, and we bring preventive checkups to the work site. And we're able to do that and provide preventive checkups to individuals at about half the cost of what most practices charge for what's an in-office checkup. To date, we've served over 600,000 individuals, and we're very proud of what we've been able to accomplish. And the proof is in the proverbial pudding. Our clinical results and cohort analyses that we've done show marked improvements in controlled diabetes, pre-diabetes, severe hypertension. We're currently in doing depression screening. We're currently doing COVID-19 screening. And so we're very proud to be a part of the preventive healthcare industry. Next slide. So the slide here and what I wanted to sort of outline for the audience is when we started our HITRUST journey, this was around mid-2018, and we actually had a strong compliance and privacy office in effect. We had an annual training program. We were performing regular penetration testing, network vulnerability scans. We had a very highly segregated network with procedures and processes in place with regards to defining subnets, connecting subnets together with secure tunnels. Routing and firewall rules were well documented, and we just wanted to always ensure that our traffic was separate among the disparate corporate staging production environments. We have very high encryption standards for both data at rest, data in motion. We had a lot of the best practices with regards to centralized logging. We used the ELK stack, and we had basically IDS, IPS monitoring with OSSEC/WASA-based monitoring agents. And I say all this to say that, you know, going into HITRUST, before we even did our self-assessment, I felt very comfortable and confident that we were going to be able to go through relatively easily. And as our presentation will show you, I was in for a rude awakening. Over to you, Ryan.
Thanks, Joe. So the HITRUST journey itself is we break, at Intraprise, we break it up into really 4 phases. And we do this deliberately because, and you're probably going to hear me say this a number of times, getting HITRUST certified or going through the certification process is a significant emotional event. You will find religion going through this process. It is not for the faint of heart. It takes a bunch of work. As Joe mentioned, he was pretty confident in his security and privacy posture, and he was. It's not to say that, you know, what we found meant that Catapult wasn't doing all the right things. It's just HITRUST is far-reaching, and we're going to talk about scope, and we're going to talk about what the assessment really covers. But just understand that if you're considering going down this path and you're really, really confident that it's going to be a breeze, it may be. I'm not saying that your organization isn't fantastic. Other organizations that we've come and partnered with to get through this process have done all sorts of other certification processes, and all reports after the fact are, this is nothing like anything else they've been through. So just keep that in the back of your mind. We're going to talk about, you know, keys to success. And one of those initial keys to success right here on the slide, you'll see it highlighted, is scoping. I actually think this is the single most important part of the entire certification process. If you get your scope wrong, you're going to be in a kind of a world of hurt to a certain extent. You may go down in a direction, you know, 6 months down the line and realize, oh, we either misscoped this, we overscoped it, underscoped it, maybe we're missing a system altogether. You're going to have to backtrack those 6 months and either complete the readiness assessment as it applies to that system, or you may have to generate new evidence, what have you. Getting scoping done and accurate upfront is absolutely key to your success. So what we want to talk about here is the preparation for HITRUST, because that's all a part of the scope. What I recommend and what we recommend is train your project team members on the framework before it starts. There's going to be a lot of jargon. You can tell just based on this presentation thus far. I've talked about requirements. I've talked about domains. I've talked about the CSF, yada, yada, yada. People have to understand that lexicon. They have to understand what the difference between a requirement and a domain is and how they interact. And when we get into actual scoring, they have to understand what's the difference between a maturity level and a maturity score, and so on and so forth. So training your team to include your executive management will be critical to your success. The CSF touches all aspects of an organization. Yes, it is highly focused on IT and security and privacy. And if you think back to a few slides ago where I showed you the 19 domains, it touches a lot of other areas. You're going to look at physical security. So what does that mean? You're going to have your facilities folks or your landlord or whomever that's going to have to provide you information about the security that's in place. HR is going to get involved. They're going to talk about hiring procedures, background checks, termination procedures, access control. What happens when someone moves from one job to the next to make sure there's no permission creep. People need to understand how they are going to interact with this certification and the certification process, and how ultimately how HITRUST, once certified, is going to affect them day to day. Joe, so let me ask you this question. You are obviously on the executive team at Catapult. Did you have to train or get buy-in from the rest of the team and or board?
So Ryan, I didn't have to get buy-in because we had set out and knew that HITRUST was a certification that we wanted to achieve. But what I did have to do was educate after I had learned more in depth that it was going to be much more than an IT/security effort. Just as you mentioned, training becomes involved, HR is involved, our compliance office, our privacy office. I recall one day I walked down to the first floor. We're in a high-rise building in the city of Dallas, and I started asking about the fire system and how many times the city of Dallas Fire Department had been dispatched for, fire drills over the past year. And they looked at me like, I just come from another planet. Why do you want to know that? And so definitely by any stretch of the imagination, HITRUST in the 19 different domains cuts across everything, whether it's your facilities, whether it's your IT, your training, business continuity plan, disaster recovery plan, all of it. So as you mentioned, you really need to make sure and be prepared as you're leading an organization through HITRUST to really educate your leadership about the scope that is truly involved.
Yeah, and a part of that, and especially when it comes to executive team and board level visibility on something like this, you really need to set realistic and attainable timelines. There are certain requirements put forth to third-party assessors like Intraprise that we can't get this done in 90 days anymore. 10 years ago, 5 years ago, that was somewhat possible depending on how mature the organization was, but it's just not possible now. If you're thinking you're going to get through this in 6 months, it's likely not realistic. You should plan for 12 months plus. I have clients that worked on it for 4 years. Now, that is an anomaly, that is an outlier, but just to give you some context of what the spectrum might look like. To shorten that timeline, engage a partner before work starts. And when I say a partner, I mean someone like Intraprise, which sounds super self-serving since that's my business. But I say that really as an unbiased, person who has been doing this for almost 10 years myself. People who like Intraprise that work this stuff day in and day out are going to know the tricks. They're going to know how to strategize. They're going to know what HITRUST is looking for, so you're not taking shots in the dark. So I recommend engage a partner way before work starts, especially if you're in development. If you're building some kind of platform that you want to go to market with next year, and you want to get it HITRUST certified, even though you're not in production, get a partner now. They can help you put the controls in place before it goes into production and have to change things when you go into production. So phase one. The biggest question that I get when talking to clients and prospective clients is, who really defines the scope of the assessment? Is it the HITRUST Alliance? Is it the external assessor like Intraprise, or someone else? And surprising to most people is it's the assessed organization. In this case, it was Catapult. You, as the assessed organization, really are the ones that get to define what the scope is. Sure, there's certain things that we can't necessarily scope out of an assessment, but you are not assessing your organization. HITRUST does not certify organizations. HITRUST does not certify people. HITRUST does not certify products. HITRUST certifies implemented systems. So you could have one implemented system or one application that you want to get HITRUST certified, and you don't want to get this secondary one over here HITRUST certified because there's no business driver to do that. That's possible. So defining scope, there's way more power for the assessed entity than I think most people realize. So what do the scoping activities look like? It really starts with initial discussions around, why are you getting HITRUST certified? In a lot of cases, people are getting HITRUST certified because there's some kind of contractual obligation. Fine. If there's a contractual obligation to get HITRUST certified, find out exactly what your business partner wants you to get certified. Have them define it. Have them tell you what the time frame is. Negotiate that if needed. But understanding the business drivers really will shed significant light on how you should scope the assessment. Because again, if they want you to get application X certified and they don't need application Y, then we don't have to worry about Y. And all of the associated, supporting systems, people touching it, all that stuff kind of goes away. You don't have to consider that during the assessment. Some of the other things that drive scoping, internal commitments, why if it's not a contract that's driving it, what is it a differentiator? If you're a hospital or a health, some kind of health system, are you just trying to prove to your customers that you're taking their personal information seriously? All those things drive scoping. I would say that scope really should be defined up front. That doesn't mean it can't change, but again, the goal is not to change scope because there's a lot of rework that may have to happen. I guess I'd love to hear, Joe, what your initial thoughts as someone on the receiving end of all of this, what your initial thoughts around scoping were.
Sure. So, really, Ryan, at this phase of the game, I really was drinking from the fire hose. And that's one of the takeaways I have listed here on this slide, is to really prepare yourself, as Ryan alluded to, that there's a lot of terminology, a lot of things you're going to have to, just sort of assimilate to get started. Once I kind of got comfortable with the process, once Intraprise Health walked me through the tools that they use, the administrative details and factors, and really kind of, prepared me for the scoping activity, it was really around determining what should and shouldn't be in scope and understanding what your systems were that you needed to get certified. For us, we sort of looked at it as table stakes, right? When we go to win business and our clients want to know and they want to see and have that assurance that we take our patients' data and their data very, very seriously and use the highest level of standard to protect it. that's really where we were able to say, okay, for example, we had some supply chain depots that really were not a part of the information system. They didn't come in contact with covered information. So it was real easy for me at that point to begin saying, these facilities don't need to be in scope, but these facilities over here do need to be in scope. These systems need to be in scope. And then I'll get to the regulatory factors, which was a whole nother beast.
Yeah, I think we're there though, Joe. I think that's where you think you're probably most challenged with the scope.
Sure. So there's a couple of things there that was really challenging. One was just, okay, you feel like you know your business. You feel like you could give the elevator pitch, but it's a fine art to be able to write that concise organizational summary and articulate all of the different systems at a detailed but not too detailed level, and then choosing those regulatory factors. In our particular case, there were some that we understood very clearly. For example, the Texas Health and Safety Code. We're based in Texas, and a lot of our clients and patients are in Texas. So that was an easy checkbox. Not so sure about 23 NYC RR 500, which is a New York State regulation and law. And Intraprise Health was very instrumental in helping me understand sort of, okay, are you actually doing financial transactions in the state of New York? No, then we're not going to check that, right? So it really helps at this stage to understand your business, understand where you're doing business and how you're doing business. Are you taking payments? Are you not? Covered information, and just the whole sort of galaxy of all these different regulations in the 50 states. Intraprise Health was just instrumental in helping me figure all that out.
Yeah, so just as a quick caveat, that's my HITRUST team, or my team of HITRUST ninjas, not me. They're way smarter than I am, so I'm glad Joe got to work with them, get them on track. So from scoping, we move into what's now called the readiness assessment. It used to be called the self-assessment. The readiness assessment really is a benchmarking, at least the way that we look at it, a benchmarking of your organization against the requirements that are in scope for your assessment. And really what this consists of is kind of exactly what it sounds like, going through an assessment and demonstrating in a meaningful way your compliance to that requirement. And what I want to do is jump ahead. The assessment itself, you are going to have to give a score, write a comment, and provide evidence for each one of these 5 maturity levels through the assessment. So if you have an assessment with 300 requirements, that you can do the math, 3 times 5 or 300 times 5, that's a whole lot of button clicks, a lot of typing, a lot of evidence that has to be generated. So it becomes, like I said, a significant emotional event just to get the readiness assessment. And one of the things that I think is critical is being honest with yourself. You don't want to give yourself hundreds across the board, because that's likely not the case. And your assessor will probably not agree with you, and you're going to have to do some rework. So you might as well try to be as honest and upfront with yourself as possible. So what do the scores look like? So as I mentioned, those policy or those maturity levels, which are policy, procedure, implemented, measured, and managed, they're all weighted, but they're not weighted equally. So you'll see that policy, process, and implemented are weighted 15, 20, and 40 respectively. Well, you need a 72 to pass, right? If you add those weighted scores up, if you're able to get 100 in the first 3 maturity levels, policy, process, and implemented, you just gotten a 75. So you've just passed that requirement, and you haven't even touched the other 2 maturity levels. A lot of organizations don't even do the measure to manage maturity levels because, truthfully, a lot of them aren't doing that type of work. Those maturity levels, as you could probably guess, are for really mature organizations. It's hard to demonstrate that you've measured and managed the requirements in some cases. So we try to strategize and focus in on doing the assessment as efficiently as possible. So what we want to talk about is, how do you move from scoping to the self-assessment? Really, so you're generating the self-assessment. You're going to do it in MyCSF. There's a number of different ways, whether you do it in MyCSF, which is the web-based platform in which the assessment needs to be submitted for certification. You can do it in an offline copy. I know a lot of assessors that do it that way. Whatever the methodology is, you really want to, one, finalize a scope. You want to train the assessing organization, or if you're the assessing organization, get trained on the proper way to fill out the comments and the realistic way to score yourself. And then really, you have to learn to trust your partner. In this case, Joe, and I'm sure Joe will love to comment on this, Joe was not super excited to see some of our comments from the readiness assessment because, again, he thought everything was very, very solid with his security and privacy program, but he learned to trust our judgment because we knew what HITRUST was looking for. So solidifying that partnership is really, really critical. I don't know, Joe, did you have any thoughts on that? Anything from the readiness assessment that you think is pertinent to talk about?
Oh, well, without a doubt, this was one of the most challenging phases of the overall project. So recall, we had completed our scope, we had gotten all of our requirements, and I was provided the rubric for the first time and began scoring myself on the different requirements for policy, procedure, for implemented. And I took the approach of not really asking for feedback right up front and just scored everything at once. And then when I sent it across and, like I said, had the rude awakening of, well, actually, you think you have 100 here, but it's more like a 25. And so it's, this was by far one of the most challenging phases of figuring out and trusting, okay, this is how this really needs to be done. And once I was able to get to that level, I knew it was going to be much smoother sailing from there on out.
Yeah, I think I remember looking at Melissa's notes, and she had a note in there saying that Joe did not like that we called his baby ugly or something to that effect. So
I didn't. I was a little hurt.
But we soldiered through it. We got on the other end. And like I said, the readiness assessment is a benchmark. That is, frequently clients get hung up on, oh, well, our scores are not perfect coming out of the readiness assessment. That's fine. You're automatically going to have to go into phase 3, which is remediation. Because as I mentioned, passing scores, 72. I think it's actually 71.99. But you want to get your scores not at the requirement level to that threshold, but the roll-up score for each one of the requirements in a specific domain to that threshold. So each one of the domains have to be passing. And going back to in the beginning of this presentation, I talked about the scalability. HITRUST knows that there's no such thing as perfect security. There's no such thing as being quote unquote secure. So they don't expect you to get 100% across the board for all of your requirements and all of your domains in order to get certified. They understand that things change. Your environment's going to change. So they look for that 72 at the domain level, which is showing your commitments and the adoption of the CSF for your program, then absolute utopia and perfection to that point. So when we kick into phase 3, what we're really looking for is a strategy to get from where we are at from a baseline in phase 2 to where we need to be to get to phase 4. So what we do post phase 2, or actually it's what really closes out phase 2, is we do a gap assessment, and we pre-score, quote unquote, the readiness assessment. So we already kind of have an idea of where the domains are from a passing perspective. So we can make smart, strategic, informed decisions on the remediation efforts. We don't have to fix every single thing. In some cases, it's not attainable. There could be things that need to be put in place that are cost prohibitive, or there's no funding for that this year, so it may have to wait until next year. We make those smart, informed decisions so we can get the domain to a passing score without having to try to fix everything. Because if we try to fix everything, it will take a significant amount of time. So during this phase, a lot of the work is on the assessed organization. So Catapult did the majority of the work in this phase. We kind of stood by, project managed, kept them on track, provided guidance for remediation, and tried to keep Joe happy more than anything else. Joe, so what approach did you take to tackle remediation, knowing that there was some things that you definitely needed to fix?
Right. So right off the bat, Melissa and her team really helped a lot here by developing a project plan that allowed us to prioritize implementation. I'm not sure if anyone's mentioned it yet, but as you're going through your HITRUST assessment, you can't just implement something on the last day and then submit for your assessment. There's implementations that have to be in place for 90 days. At least this was when we were going through this last year, to receive full credit for those areas. So Melissa and her team had put together a project plan. We prioritized our implementation items, and it really helped focus on those boulders we knew we needed to address right away.
Yeah, I'm gonna speed it up a little because I know we want to get to some questions at the end. So jumping into phase 4, now the roles kind of reverse. So in phase 3, a lot of the work is done by the assessed organization. In phase 4, we take over as the third-party assessor and really do the majority of the work. So the way that Intraprise works their methodology is we actually do what we call an adoption review post phase 3. So as Joe remediated things within his organization, we would take a look at what he remediated and say, yeah, that probably works. You're on the right track, or that satisfies the requirements. When he submitted those domains back to us, that's when we could do our validation work. And really, what we're doing is getting into validation and removing the chance of any surprises. So as an external assessor, as it's called now, we cannot actually remediate anything. At least not anybody on my team. There has to be a separation of duties at the executive level for any of those activities to occur. So we can't necessarily fix anything, but we can provide guidance through that process, which we do prior to phase 4. So phase 4 really is all about testing and validating that what Joe said he has in place in his self-assessment and his readiness assessment is actually in place. So we're required to come on site and do testing, and we do them by requirement. And during that testing, we will either validate or adjust the scores and actually acquire our own evidence in some cases to demonstrate that, one, the testing was complete, but two, more importantly, that the requirement has been satisfied based on what we see in the environment. So, Joe, how did you all prepare for on-site testing? Was it crazy for you? Was it relaxed? You know, what were the thoughts around that?
Sure. Well, it was relatively relaxed because, as you mentioned, by this phase, we're really going back through and you're double checking all of the work that we have done thus far. So as we went through the 19 domains, we were going through and making sure that our scores were passing across all the domains. We had to make little minor tweaks to requirements here and there, but as we kept iterating, the scores kept coming up, they kept coming up, and once Melissa called and said, Joe, you're ready for on-site testing, I really kind of relaxed and was able to take a bit of a breather because you and Melissa and her team had prepared us for that moment.
Yeah, and just to add a little color, that on-site testing, as we mentioned earlier in the presentation, the framework itself touches all aspects of the organization. We're likely going to walk around, we're going to talk to random people that are there, we're going to talk to HR folks, facility folks, we're going to do testing for all the above, we're going to do testing on endpoints, so on and so forth. We're going to take pictures if needed. So we're really going to kind of touch the organization as a whole as it relates to the certification, just as a, to add a little color to what that consists of. Joe, I know when we were preparing for this presentation, you made a comment about your fire extinguishers that I thought was pretty relevant and funny.
I made the comment that I was not aware that we had so many fire extinguishers in the office. So Melissa and Liz, Josh, they came, it was actually like a day after a tornado had just hit the North Dallas area. So we were all glad that they were able to safely arrive. And by that point, we were, sort of relaxed and we sat down together. It was, like you said, really just going through walkthroughs, clean desk policy, everything we said we were doing, y'all were ensuring that we were doing. And after that, we went down and checked out the San Antonio office as well.
So to kind of close out phase 4, once we get done with all of our testing, as I mentioned, we validate all the scores. We typically get agreements if we decide to lower score for reason X, Y, or Z. It doesn't happen a lot, but when it does happen, we get agreement from the assessed organization. If we weren't already working in the portal, we upload everything to the portal. Then we all get excited and we hit submit. And that assessment is then sent to the HITRUST Alliance. So this is where the assurance level goes up, is when someone receives a HITRUST report from you, that person or that organization can be assured that those things are in place because it's gone through several levels of checks. So the management of the assessed organization has validated, because they're required to submit a letter with the submission, validating that the submission is accurate, it's true, there's nothing fraudulent in there. An unbiased third party like Intraprise also goes in and validates that readiness assessment is accurate and it's true. And then post-submission, it goes to the HITRUST Alliance itself, the governing body, and they put it through a series of quality control checks, which takes about, I say, 8 to 10 weeks. And there's a lot of back and forth with the assessors in some cases, just for clarity purposes. There's always going to be checks that HITRUST does. So it's not instantaneous whether you're certified. There is a little bit of little work that happens after submission, but I can tell you that we have a pretty good track record of getting folks certified, and that's because, as I mentioned, by the time we get to this point, there's no surprises. And it's just a matter of working through the methodology. But lo and behold, Joe, I'll toss it over to you because this was a happy day.
This was a very happy day. So as you were mentioning, and for those, we submitted everything around I guess it was November the 8th of 2019. And it wasn't around, I guess, until mid-January of this year that we received our draft report and had to go through, and we'll talk about the corrective action plans that we had to provide, responses and project plans for. But on February the 5th of 2020, the final report was posted. You see there myself in the center and some of our client success team members who actually are able to now go and tell their clients we're HITRUST certified. So it was very rewarding and a very fun day that day.
So Joe, where are you going from here? As you noted on this slide, it's never done.
It's never done. So we knew immediately once we started putting together our corrective action plan that in preparation for the interim assessment, which we're going to actually start here in the middle of August for the calendar 2020, is, like you said, meaningful progress against our caps. So right out of the gate, 2020, we received our caps that we needed to begin remediating on. I'm fortunate enough to now have a set of additional individuals that are helping me manage that and to, implement a lot of them themselves. We also have our security risk assessment that we needed to do, which was one of our requirements, the interim assessment itself. And then 2021, you have to get recertified. HITRUST, unlike some other certification programs, is not one and done. It is an ongoing process. They continue to raise the bar. I won't go into the details of the different versions of the CSF, but we're always kept on our toes with HITRUST certification. I can tell you that.
As are the folks that would try to do harm to organizations. The whole point of demonstrating this security and privacy solid posture. So, Joe, here's some lessons learned that I thought were really astute and critical to cover. But I want to be sure that we are considerate of time. So I want to get some time left for questions. So if you wouldn't mind working through these, but in an expedited manner.
Yeah, so basically, right at the very beginning, I mentioned the rigor of the compliance and security regime that you have in place. And remember that you're going to be covering all of these different domains. And if you don't have a good sense of your existing infrastructure, whether it's change management, network change management, production deployments, can you provide evidence? Do you have all the tools to do that? You're going to be in for a long haul. And again, just being prepared to not take it personally when you get that first assessment, right? It's just a higher bar if you've never done it before that you've probably not gone through. Be realistic with regards to the timing. Just one phase was 350 requirements, and I had to go through 1,000 of those because I have policy, process, and implementation. So you can just do the math as to how much is there. Just having a structured, being structured and having a plan, working with your assessor, that's why they're there, to help you navigate this. They're really your coach, they're your guide, they're your Sherpa. They're going to be the ones that are going to be with you along the way to get your certification. And again, education and promotion within your entire company. It's far-reaching. It touches every single aspect of the company, and a lot of people may not be accustomed to the level of rigor that this sort of regime puts in place. So educate them. Over to you, Ryan.
Thanks, Joe. So I think that actually concludes the formal presentation portion. I think Siobhan.
Yep.
That came in?
Yeah, we have some questions. So I'll just thank you both. Thank you, Joe, especially for joining us on this. If anybody, we have a couple of questions coming in. If anybody else has any more, just add them to the Q&A section or the chat section. The first one we have is, can we do self-assessment on our own and then engage the partner after we get the report for gap analysis?
Yes, yes, absolutely. I wouldn't personally recommend it. Again, scoping being the most critical portion of this assessment. You want to make sure you get it right up front, because if you scope it wrong, go through an entire assessment, get into remediation, realize the scope is wrong, then there's a lot of backtracking. But yes, you absolutely can do the readiness assessment on your own.
Okay. The next one is, how does on-site testing work now with COVID and folks working from home?
Yeah, that's a great question. So fortunately, the HITRUST Alliance released an advisory mid-March, I believe, maybe it was towards the end of March, beginning of April, that alleviated the need to go on site in light of COVID. So what it looks like now is we do all the testing remotely. If you're able to get into your office, we may ask one employee to go in, walk around with the cell phone camera or what have you. So it's kind of a virtual tour. In some cases where organizations were not able to get into their offices, we would just set up a kind of a web share, and we would bring different people into the web share at different times. So it all had to be pre-coordinated where we could do the testing that we needed to do, whether it be endpoint or, something on the network, or, looking at firewall rules and things of that nature. So it really is kind of custom to each organization and what they're able to do. But right now, I sit on the third-party assessor council, and the last meeting that we had, HITRUST said there's really no plan right now to lift that advisory. So we're likely going to be doing virtual testing at least through the end of the year.
Okay. Here's another one. Can the same organization be both HITRUST Readiness Consultant and HITRUST Assessor?
HITRUST Readiness Consultant and HITRUST Assessor. So meaning that you are helping them get prepared and maybe doing some of the, policy writing, procedure writing, and remediation type activities, and be the third-party assessor? Yes. The answer is yes. Actually, Intraprise does exactly that. But keep in mind that there has to be a separation of those individuals in the organization at the executive level. So if you have an assessor that is doing all the remediation activities and an assessor that is doing the actual certification work, if they report to the same executive, then you cannot do it. They have to report for different executives within your organization.
Okay. And then the last one we have is, so what are Joe's next steps with regard to HITRUST?
Well, go ahead, Ryan.
No, I was just going to say, I think we covered that a little, but Joe, maybe you want to talk about a little bit of the detail about some of the caps that you're working on, the challenges of doing those caps and understanding some of the requirements.
Yeah, sure. So I want to say we had around 80 corrective action plans, and we, like I said, went through and sort of divide and conquer, was able to split that up amongst a few different departments. We're working through those plans now in preparation of starting our interim assessment here in the middle of August. We've just completed our security risk assessment and are going through and evaluating those findings. And then, yeah, just continuing to raise the bar, make improvements where we can, and looking forward to the next round of HITRUST. Quite honestly, like you said, it really has been an enlightening and quasi-religious experience, to be quite honest, and it's been well worth it for Catapult Health.
Okay, Well, that's our last question. I wanted to thank you both for presenting and everybody for joining us. If anybody wants future updates on future webinars, please follow us on LinkedIn. And if you have any topics you'd like us to cover on future webinars, please let me know by emailing me at scarroll@Enterprise Health. So thanks a lot, gentlemen. I'll talk to you soon.
Thanks, Joe. Thanks, Siobhan.
Thanks. Bye.
Thank you all. Bye-bye.